And Isabel Islets from Chaplaincy Healthcare in Corks Place. Before Wanda and Isabel introduce themselves, there's a few housekeeping items that we need to go over. First of all, this program is for information only and not intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the help of your medical provider for health concerns. To ensure the sound quality is good, please make sure to mute yourself and to stay on mute until asked to come off to ask questions. To mute your audio, click on the microphone icon on the menu bar. If you feel comfortable doing so, you may turn on your webcam. Please type your comments and questions into the chat box until you have been asked to unmute. You can access the chat box by clicking on the message bubble icon. I will be monitoring the chat to ensure that questions and comments are not missed. There will be a link to a survey posted in the chat box at the end of this presentation, and the same survey will be emailed out to you as well. Please complete the survey to help us improve and plan for future educations. Unfortunately, technology is not infallible, so please bear with us as we troubleshoot any technical issues that might arise. Our goal is to give everyone as smooth an experience as possible. However, we also know that life happens and we will do everything in our power to get the presentation back on track as quickly as possible. And now, Wanda and Isabel with Compassion Fatigue.
Thank you, Megan, and thank you, Sue. We really are very grateful to be able to partner with Cadillac to offer this presentation to you. We are aware that some of you may be rejoining us from had attended the first session last week. Welcome back. Some of you may not have attended that, may be attending for the first time. So for you, just real briefly, we would like to do kind of our quick introduction so you know kind of our background and why we have the passion for this type of work. I am Wanda Contour. I've worked with Chaplaincy Healthcare for 21 years. 20 of that was a grief care specialist in our hospice program. 18 years I have worked with Corks Place, which is our program for grieving families, children, teens, and their adult caregivers. And that program is modeled after the Dougie Center in Portland, Oregon. Some of you may be familiar with them. My personal passion for the work comes from several family members growing up. I never understood why my mom had so much need to talk about her dad, who had died when she was 11. And it was very frustrating for me as a little kid to have to try to be supportive of that and to hear those stories over and over, not knowing, of course, until doing this type of work, why she was processing all those decades later. She never had that chance as a child. My passion also comes from my own children, my stepchildren, whose mom died close to 40 years ago when they were teens and preteens. And at the time, I was very ill-equipped to help them. I didn't know what to say or do, and do know now. I had said a lot of things that actually made their grief more painful for them. So between family members and everything I've learned, I'm just very happy to be with you and to be able to share more information with others that maybe can help them in their own personal journey.
My name is Isabel Islas. I'm another staff member here with Chaplaincy, our Corks-based department. I actually did my internship for my MSW a few years ago with Corks Place. That's how I got kind of introduced to this side of the fence of Corks Place. I worked as an outpatient child and adult therapist as well for a year, and returned as a full-time staff member as an adult and youth grief specialist. I also do Hispanic outreach, providing our grief services to the Latino and Hispanic community in the Tri-Cities area. My passion personally came from bringing my brother to Corks Place 9 years ago after the death of my mom and sister. So I stayed in the adult group and he went to our preschool group, which is our youngest group, ages 3 to 5. And just seeing that impact on him and the vocabulary he learned and how he processed his own grief really was a model for me to be able to face what challenges I had in my own life at that time. And it brought me back to Corks Place, and I feel very passionate about our program, about our model, and very excited for you guys to be a part of this and learn a little bit more about the different communication methods and skills that we use and how we can help others in our community during a really difficult time in their life.
Thanks, Isabel. So today, as Isabel mentioned, we will be talking not so much about grief and grief reactions, but what are the communication methods that can either hinder the conversation or shut down a conversation with somebody who's hurting or grieving from any kind of a loss. And what are those communication skills and techniques that we can learn and use that really help to open up conversation? And we have benefited hugely in our work learning these skills, but also even personally with our own families. That's a part of how our families have been able to continue to heal over the years. We will be viewing slides, of course, watching several videos. This is an interactive opportunity for you to ask questions, give feedback. If you have a short story you'd like to share that fits in with what we're talking about, we welcome that and we'll adjust the time for that. So we're going to go ahead and get started with a short, kind of a little poem, I guess, that I think is very impactful. It says, if you share my tears, if you take the first merciful step toward me, if you walk bravely into what I am feeling, then we begin to bring down that power of despair. So for us in our work, I think that's what's been the most important, is gaining the knowledge, learning the skills, the communication skills, and then developing the courage to step into someone else's, if you want to call it kind of a sacred space, where they're in their own pain and hurting and most often feeling very alone and isolated and like they're doing something wrong. So with us learning how to do things differently, we've been able to companion many, many people of all ages in the grief journey that they're going through. So we're going to just look at a list of communication skills. It's a short list. Isabel will kind of explain these. Sure, most of you probably are aware of these already.
Thank you, Wanda. Yeah, here are a few effective communication skills that we always use at Clark's Place. And we use these also with our volunteer facilitators here at Clark's Place in groups. The first one is attending behavior. Now I think about this physically, like how am I physically presenting myself to the person that I'm listening to, that I'm companioning during this time, whether that's nodding my head, subtly making eye contact without being overwhelming. Sometimes eye contact can be overwhelming, maybe leaning in a little bit, but really thinking about my physical appearance, like how am I physically presenting this person that I am listening, that I'm here, that I am present. Silence. When I first read this, I was like, how is silence an effective communication skill? But it is, because when I thought about my own grief experience and how it was for me to be in the adult group that Wanda was facilitating, I am an internal processor. It was very difficult for me to express verbally my own grief experiences. So knowing that there are people with that challenge, sitting in silence really allows the participant, that person grieving, to maybe get the courage to express their grief or to make sense of what they're feeling, what are some thoughts going on, but also just to sit in the moment, to sit in that uncomfortability, whether they're crying or just really upset, whatever feeling they're having, but to be able to sit with that is really a gift that we can provide, because oftentimes we try to fill that silence because it makes us uncomfortable. So paraphrasing and reflecting, we can do that with a word, a few words, or a couple sentences, whether that's, they may say something like, I had a really hard day today. School kind of sucked. I didn't like it. Oh, you had a really hard day. School sucked. So just reflecting back their words, their emotions, without trying to change it, without adding judgment to it, but just really mirroring what their emotion is. Clarifying. Clarifying can be a great opportunity to empower the other person to correct any misunderstandings. You can say things like, so what I'm hearing is you had a hard day at school. Is that right? Or they may, take the opportunity to correct you, which children and youth often don't get that chance with their relationships with other adults outside of group. Using open-ended questions, because I feel like as adults, we usually we talk to children. We don't really talk with children, talk openly with children. We may ask, how was your day? Or did you have a great day today? But we don't elaborate more. They may use yes or no, and that's the end of that conversation. But really asking open-ended questions. How was that for you when that happened? Or using I wonder statements. Now, this is a skill that we use a lot at Quark's Place because it's a statement where they're able to answer. It's not so directive and it doesn't feel as intimidating. Um, I wonder, I wonder how that felt when you had to move schools and just kind of leaving that statement out there, and they may or may not answer. Limited and appropriate self-disclosure. This is something we also use in the beginning of our group. We may share briefly about our own loss, an opening circle, what we call the beginning of group. The children have the opportunity to share their name, age, their person who died, and how they died, and allowing them to hear briefly our own name, age, person who died, and how they died helps them connect. Oh, okay, this person also lost someone, or they also understand somewhat of what I'm going through. Again, not taking the focus off of them, but allowing them to see briefly of what that grief was like for you.
On this slide, it says what to say when someone dies. I think some of these can be used with anybody who's hurting or really struggling. Some of these, of course, are specific to death. But what we're going to do to kind of show you or model how it sounds when we say something that can be more effective, or when we say things that we often do that maybe are less effective or on a scale, let's say from less effective to downright really hurtful. So we're just going to read back and forth. I'll start a what to say, and then Isabel will follow with what not to say, and we'll go through the list. And just kind of maybe for yourself, see which way you tend to kind of respond to people, what sounds more familiar to you. I'm sorry. This is so hard.
I understand how you feel.
I'm sad for you.
Death was a blessing.
How are you with all of this?
It was God's will.
I don't know why it happened.
It all happened for the best.
What can I do for you?
You're still young.
I'm here, and I just want to listen.
You have your whole life ahead of you.
Please, if you're willing, tell me how you're feeling, what's going on.
You'll feel worse before you feel better. You can have other children.
So for anybody who would like to just share a thought or a comment, or maybe just share which one resonates more with how you typically might respond to somebody that's hurting, whether you put your comments in the chat or whether you just want to go unmute yourself and share, we're open to any conversation around this. When we've shared this in the past or done this at other kinds of trainings, often people will say, oh, I didn't realize those things were not what I should be saying. And I know that for myself because I've used a lot of the what not to say prior to my work with chaplaincy healthcare. So any thoughts that any of you have, or comments, or a particular story?
Hi, Wanda. This is Lori. I'll share for a minute.
Thank you.
So at the Cancer Center, we're dealing with a lot of people that might be faced with, that their cancer is, they're not going to make it. And I just think that saying that you're sorry and just acknowledging that this is really hard is one of the best things you could say to somebody, They seem to respond well to that from my experience.
I couldn't agree more. That would be very, very hard news for them to try to wrestle with or feel like they want to protest. And so you're just hearing your voice and how you said that, I imagine for them feels comforting without trying to direct them one way or another. Anybody else? Thanks, Lori.
And Wanda, really quickly, while maybe people write their comments or whatnot, but one thing too to keep in mind is these are just common things of what to say, what not to say, with also keeping in mind that people's grief is very individualized and they express and they process their grief differently from one another. So, similarly, if someone says, I'm sorry, one person or most people may find that very, very helpful. But we've heard it in the past where hearing the words, I'm sorry, of that was not helpful. How are you sorry? You didn't do anything. Again, these are just common what to say, what not to say that can be helpful or hurtful, but just keeping in mind of taking that person's lead. Of this is okay, this is what is helpful for them, and this is what's not helpful for them.
I appreciate you saying that. One of the things that I have mentioned to people is after I've shared something, how was that for you to hear that? That's a kind of a follow-up question that I'll ask because sometimes if we're kind of going in a back and forth dialogue with somebody, I don't always know or they don't always feel safe being able to share their reaction to what I've shared or even a question that I've asked. I might say, how was that for you that I asked you that question? Because sometimes it isn't about the answer. I don't need the answer. Part of our goal, if you will, is to make it safe for people to open up and be able to talk. Thank you for your comments and your thought. We're going to go ahead just watching time and move forward. Goodgrief.org is a great resource for just handouts, information. There are some videos on the website as well. They have several tip sheets for different things that we just would invite you to go if you're not already familiar with them. But one that we're going to be sharing today, starting with this next slide, we're going to actually have uploaded the slide into the PowerPoint. And it's 10 tips for communicating with grieving kids. Not going to read these, just kind of paraphrase through. Number one, I think is obviously number one for a reason. Listen, truly listen. And I would say and when you mentioned, Isabel, about silence, I think we at Cork's Place and our grief care program with chaplaincy, we have become very good listeners because we know the power of it. So if I ask a question and someone doesn't want to answer, I can sit in silence and allow and say, seems like that might be kind of tough to answer. That's okay. We don't have to talk about that. Just permission to, or if they just start talking a lot, making sure we're in a place where we can really hear and allow that to happen. Being fully present or as present as much as possible. I know in a personal life, we can be very busy. And as Isabel mentioned, maybe ask a family member or one of our children a question. And we think we're going to be listening, but we're also multitasking and doing a lot of other things. And the child or the teen or our partner or spouse, they're pretty aware we're kind of distracted and not as fully present as we might be. Kind of reiterating the open-ended questions. The closed-ended questions are fine, but if our hope is, or our end goal is to make it safe for people to share more, we want to say or ask things in a way that invite story, that invite them to share feelings or thoughts or frustrations or whatever it happens to be. So those are the first three. These next three follow their lead. This is a huge or a very significant part of our Corks Place program. The children are the boss, is what we tell them when they come, or the teenagers. They're here to do their work in their way, in their time frame, whether they talk or don't want to talk. We have a lot of things they can engage with. So however they lead out, our volunteers go through a 30-hour training, and we as staff work very hard to listen to them, to follow what it is they want to do without trying to distract them away from that path. They know their grief better than we do. And I do the same when I'm facilitating adult groups or listening to somebody, as I kind of let them go where they want. Being authentic, I think a part of authenticity is being in touch with our own emotions, our own feelings, our own thoughts about grief and how to be supportive. We had talked some about that at the end of the first session and how important that can be to be authentic and present. Listen and then talk during the in-between times. So it may be that we think sometimes we have to sit down and look at a person and have this conversation with them, when in reality, it can be more helpful, at least with children, is if you're in a car taking a drive and asking some of these authentic based open-ended questions and then being silent, because it's not looking at each other, or like this says, taking a walk. Maybe it's doing some activity, some kind of parallel activity where it's not looking directly at each other, but giving space for however the conversation unfolds.
The next few skills is, the first one is honesty matters. And we also mentioned this in our first presentation of how important it is to be as honest with children as possible. That's something we encourage here at Corks Place, because children and teens often know way more than the adults believe they do. They're really great people watchers. And not being honest can be really difficult for them to process afterwards and add this other complex layer on top of their grief. But not only being honest with the grief, but also being honest when it comes to sharing our own emotions by modeling. If maybe we're having a really hard day and I'm not sure, I'm really having a tough day right now. Taking the time to share. Like Wanda mentioned before, sometimes it can be really helpful for those in between times because we are so busy. But making a routine with your child or teen or the person you're providing support with can be really helpful. Oftentimes at Corks Place, we'll hear back from the adults. They have a routine about talking about their person who died, either on their way to group or coming back from group, or they create a routine of stopping by and getting ice cream, but that's their time, their special time to share. And making that time to share those conversations places of comfort. By that we mean kind of going back to taking their lead, asking what is it that they need from you. Maybe it's not that they need advice. Maybe they just want to share, need to release some of their emotions out, or maybe they are having some questions about their person who died, or helpful tips that you found helpful for you in your own coping. But going back to taking their lead, what is it that they need from you, whether that's silence, advice, validation, or just reflection? Being spontaneous. Sometimes grief can be very spontaneous. Oftentimes it is. So what we hear, especially with the little ones, is maybe their adult takes them to the store and they just start talking about, my daddy died, and sharing with strangers. And it can be mortifying for their adult, like, oh my gosh, we don't talk about this outside of our home. But taking those moments when possible to talk about their person who died, or invite them to share what is it that they feel about what's going on, or share those emotions. And also remembering that no one's perfect. Communication is really difficult, and it's really difficult to change once we create a pattern of speaking and a type of relationship that we have with other people. And these are just suggestions. They're not must-dos, but just remember to give yourself grace when it comes to, having these communication times with others. Sometimes we may say things that aren't helpful, but just owning that as well, that can be difficult. But one thing I do is kind of going back to Wanda mentioned before, is giving them permission to express any moments that maybe they found uncomfortable or not helpful, to continue that conversation.
Gosh, speaking of imperfect, this next handout, we're going to look at just briefly, kind of looking at the time here. We kind of need to get back on track time-wise, but parenting styles, because how we parent, how we communicate with our children, either will help them feel safe, want to open up, be able to be honest about whatever it is they're expressing, or it may be that we tend to close them down by our parenting style or by the way that we communicate. These particular handouts, as well as other really good ones, are found on the website Parenting Counts. And they're very, very helpful. We'll just talk about two of them. So this first one, parenting styles, there's 4 main styles on here. And the first one, it might be a little bit hard to read because it's in blue, but is the dismissing or the dismissive type parenting. And basically it's, for whatever the reason, adults have not learned to do their own grief work. They're not comfortable with the topic. It's maybe a generational unspoken rule in their home. We don't talk about these things. So then they tend to dismiss their children's reactions, thoughts, feelings related to grief, or just emotions about anything. It just kind of shut that down. And then the second one is disapproving, where it's goes kind of beyond dismissing and actually maybe kind of has a way where we have some energy around shutting that down, or we're super uncomfortable with it maybe. I would say that's probably more the home that I grew up in based on generations of that parenting style. I've parented that way, so I've had to work at that and be much more supportive. Another one is kind of or considered laissez-faire, where they do acknowledge the feelings, but they don't necessarily help the child to know, or teen, how to set boundaries and kind of take ownership of their feelings, or what they need to do to heal. And the one that's most effective that they talk about on this handout, and then we'll talk about a little bit more, is called emotion coaching. It's doctors John and Julie Gottman who created, maybe some of you are familiar with their work. They've done years of work as marriage and family therapists, lots of parenting work. And this emotion coaching, if you want to go ahead to the next slide, Isabel, excuse me, is broken down into 5 steps. And just real simply, it breaks it down more on the handout, but basically it's being aware of your own emotions. What are you feeling? Are you comfortable? Is there more work that we as the adult can do to be at, not at peace, because we may have to wrestle with our own emotions, but at least be in touch with them. Connect, really truly connect. And some of those tips from the previous handout can be helpful for that, finding ways, times of the day, the way we can be more fully present to connect with our child or our teen. And then listen, truly listen to what it is that they're saying. What are they trying to communicate? I think so many times we go into, call it parenting mode, where we have an agenda or an objective to help our children be good citizens, learn their manners, not talk back, just things that are all very good and necessary. However, when it comes to emotion, it's super important to let them learn how to name their own emotion or help them to name it, how to own it, how to allow them to feel it, so that then they can learn, number 5, what to do with that emotion, how to be able to work through it, not stuff it, not let it come out in anger at someone else or on someone else. So those are the simple 5 steps, and they are described a little bit more in the next handout. However, they actually created a whole training manual with multiple sessions and handouts and a DVD that goes with it, all about these parenting styles and specific to emotion coaching. So those can be very, very helpful, both professionally, I think, especially if we work with families. Like I share this information a lot with the adults here at Cork's Place when we're talking in the adult group. So at this point in the training, we're going to transition from kind of things related to grief and loss and understanding the grief reactions, how to really develop better communication skills and techniques, and focus on more compassion fatigue, understanding what it is, what the definition is, how it impacts us, how do we kind of learn to do a self-inventory, what do we do when we're experiencing compassion fatigue. So it's kind of a shift today into a whole different topic that we're going to be focusing on. So I'm going to read a small section. It comes from the introduction of the book Trauma Stewardship, an everyday guide to caring for yourself while caring for others. And the title of this introduction is On the Cliff of Awakening. And see if there have been times maybe in your experience, either as a professional, a person maybe who's working a lot at home, or maybe you've been in a caregiving role with a parent or somebody in your life. A lot of us can experience compassion fatigue. It doesn't just have to be on the job. But here is what this person, how she came to realize she was experiencing compassion fatigue. Are you sure all this trauma work hasn't gotten to you? He asked. We were visiting our relatives in the Caribbean. We had hiked to the top of some cliffs on a small island, and for a moment the entire family stood quietly together, marveling, looking out at the sea. It was an exquisite sight. There was turquoise water as far as you could see, a vast cloudless sky, and air that felt incredible to breathe. As we reached the edge of the cliffs, my first thought was, this is unbelievably beautiful. My second thought was, I wonder how many people have killed themselves by jumping off these cliffs. Assuming that everyone around me would be having exactly that same thought, I posed my question out loud. My stepfather-in-law turned slowly to me and asked his question with such sincerity that I finally understood my work had gotten to me. Just before we start into this section on compassion fatigue, is there anything from the reading of that introduction or through your own experiences where you have become aware that you have been in a place of compassion fatigue? Anybody in the chat box or a question that you may want to just unmute and ask, or a comment? Or while they're thinking about that, is there anything for you, Isabel, that you may want to talk about?
Yeah, I remember when I first read the, trauma stewardship, and that passage specifically spoke to me so much. It was really my first introduction to an understanding of what compassion fatigue was. And it made me realize how this is not only relevant and present in different fields where, such as the medical field or, our mental health field, but all these other fields that we probably don't think about, whether those are attorneys, for first responders, even just being overwhelmed at home with COVID and, speaking to parents sometimes or teachers, trying to provide these different types of support. I realized how really easy we can slip into compassion fatigue and not realize it. And we'll have these moments of, oh, okay, this is where I'm at right now. So that's, my understanding, and this passage really speaks to me in that way.
I think we'll go ahead to the definition, and if anybody has a thought that comes to mind, please feel free to type it in again to chat or just to unmute and share it. Charles Figley was the one who really originally defined compassion fatigue. I've not read books. I understand he's written many books, talked about this for many years, as now other people have as well. But this from his writing, he says, we've not been directly exposed to the trauma scene, but we hear the story told with such intensity, or we hear similar stories so often, or we have the gift and curse of extreme empathy and we suffer. We feel the feelings of our clients. We experience their fears. We dream their dreams. Eventually, we lose a certain spark of optimism, humor, and hope. We tire. We aren't sick, but we are not ourselves. And I know for myself, having experienced compassion fatigue, sometimes it comes on quickly, sometimes it's kind of slow and sort of insidious, and you just can't quite figure out what's wrong, what's going on until you stop and really do kind of an inventory. This next slide, we often when we present this training, we do it to a workplace, an organization, or an agency. So the whole staff or a part of the staff team will be going through this presentation together. And so these breakout sessions were designed to do that more in that context, and then we break out into smaller rooms. Well, we're aware that we're a mixed group today, and we're really grateful for that. We also are aware that our Microsoft Teams does not allow us to do breakout sessions. So what we're going to do is ask these questions as you see on the screen, and then just invite conversation. We have dedicated time with each slide, so we're hoping to maybe this can spark some feedback or some thoughts or further questions. Not that we have all the answers, but at least sometimes asking the question can just bring more conversation. And the first question being, when we say compassion fatigue and self-care, what would you hope to learn or take away from a session on these topics? And what we can maybe do is just, I'll read through all three, and you don't have to answer a particular one. You can just jump to what speaks to you the most. Second one being, what are the biggest obstacles in your job when it comes to recognizing compassion fatigue in yourself or others? The third question, what are the biggest obstacles in your job when it comes to processing hard experiences? So anybody is welcome just to, if you want to identify where you work. If you'd prefer not to, you can just share your first name and start talking, and we'll have no idea where you work. So it doesn't, expose anything about your workplace that you don't want exposed.
Oh man, your phone's making that weird noise. I put it up on here. Yeah, I don't know.
Did somebody unmute to share?
Sure, I'll share. I used to work as a medical assistant And this is in relation to the third one.
Okay.
And one of the biggest obstacles in that job was you had to get out of the room as fast as you could. Like you had to room a patient as fast as you could, and which was silly because you had all these questions you had to ask, and you had to still be compassionate with your patient, and make them feel like they were cared about, because you did care about them, but you had this job to do and you looked like you weren't doing your job. And so you felt like a jerk. And so I feel like it was really hard at the end of the day to not feel like a jerk and to not feel like I didn't do my job, because all day long I just felt like I was pushing people through a cattle run. But the thing, and what was really dumb about it was these people would still be waiting in the room, and the provider, whoever it was, wouldn't even be ready for them.
Mm.
But I mean, they'd say, and hurry up, okay? Because I know, you take a long time with your patients. I was afloat for 3 years. Before that, I was always working in a clinic, like stationed somewhere. But for the last 3 years of my time as a medical assistant, I floated because it was less dramatic that way. But I always felt like I was going to treat my patients how I would expect my family and my friends to be treated. And so that's how I was going to treat my patients. And so that's how I did it. But still, it didn't matter. At the end of the day, I still felt like a jerk because I felt like I was pushing them through a darn cattle run.
Mm.
And I'm sure all my folks out there, all my friends out on the front line still feel that way.
That's very descriptive. I appreciate your courage to share that. I would imagine, having worked with and alongside, not directly alongside, but nurses, nursing assistants, the folks like in our hospice program, we're under an umbrella organization, one of the other programs being hospice. It's that same type of thing. Is there's the reality of the time factor and what needs to happen. And then there's the whole reason that, especially as a medical person, you've gone into the profession, which is for people, and about compassion and sharing around medical needs or medical issues. And so it sets up a conflict. For us, sometimes it feels like the need is never gone. It just continues to grow, and our desire to help continues to grow. And sometimes we can't make that. Like at the end of the day, you think, I should have done more. I should have done better. Thank you. That was very well said and very descriptive. Anybody else have a thought or a comment or can relate to any one of the questions or relate to what was shared so beautifully? Corinne, do you have something you'd like to say?
Yes. What is so important right now in COVID that compassion fatigue is like, it's just going to be there. I taught school for 17 years and I know teachers. I live in Othello and right now I work for the library. And there's also the anxiety of protecting loved ones from getting sick. And how can we protect medical workers? I would say compassion fatigue is kind of endemic. I went to a training recently that said 67% of library workers in the state of Washington are exhausted and very, very anxious. So I think the word is to be kind to ourselves and be really patient, because the people across the country are under extreme stress. Thank you.
I am grateful that you shared, in part because it was new learning to me. I would not have given that thought about a person working in a library having that heightened awareness of, again, I guess I should, everybody's having to do it, but I think we're all just really tired of the pandemic and the extra caution and the masks and the cleaning. So I agree that it's just kind of endemic right now with everything else that's going on. Thank you very much, Corinne. Someone else before we need to move forward, a thought, a story, something about your particular line of work, or if you're working from home and experiencing compassion fatigue, we would appreciate hearing what you would have to say as well. I would just say in closing, before we move to the next slide, that I think from our experience, it's both how we are gearing up to start a new year of support groups and how we can practice all these protective protocols that's going to, excuse me, work to keep people safe. But the other thing is a lot of our families in the homes, some couldn't work outside the home because they've had children home, are experiencing compassion fatigue because they're trying to do all this work in the home, or we're trying to help their kids with homeschool and working with all this technology they weren't familiar with. So I do too think it's just across maybe the world, actually. Thank you. So we'll move on to the next slide.
So we're going to get into a little bit more about the types of symptoms that are really common with compassion fatigue. And this description, or this image, really shows how compassion fatigue, similar to grief, touches all of our different layers as a human being. Not just one aspect is affected, but all of our whole body, all of our self, all of our being can be touched and affected in different ways by compassion fatigue. So talking about more specific and breaking down those domains more, based on our cognitive level and our mental state, some symptoms of compassion fatigue can look like trying to be perfect, having everything perfect, and also thinking, if I do this just right, I can help this family in this way and I'll make things better. Or being preoccupied with the trauma or the story that they're telling, having that story or carrying that story, I should say, over and over and over, not leaving it at work, or not giving yourself time to step away from that, to step away from holding that space, spacing out, losing the loss of meaning, having self-doubt, and doubting not only yourself, but sometimes doubting the agency or the type of work that you're into, that you have. Some emotional symptoms can include feeling powerlessness, anxiety or guilt, survivor's guilt, depending on the type of work that you do, having an emotional roller coaster, or just feeling very, very overwhelmed because life continues to go on. And we may question, how can it be possible that I'm doing all of this? I'm giving my 110%, but these tragedies or these really hard stories or hardships are continuing to happen, and maybe not feeling like you're seeing the result that you want to be seeing. Some behavioral symptoms can include of withdrawing from your own family, feeling really irritable by minor inconveniences that maybe you weren't irritable before, sleep disturbances, whether you're having difficulty sleeping, or you're sleeping so much you feel really exhausted all the time, accident prone, losing things as well, and hypervigilance. It can affect us spiritually by just questioning the meaning of life, or questioning your purpose in this role, or your purpose in the type of care that you're providing, or the type of relationship or support that you have with others. Losing self-satisfaction in your role, or in Things that used to give you enjoyment are no longer satisfying, and also questioning any religious beliefs that you may have. Some personal relationships can be affected as well by withdrawing from your support system or mistrusting your support system as well because they don't understand what you're going through. Only you can understand because you lived through that. You lived through supporting this other person. Being overprotective as a spouse or parent, I know this is something that I struggled with after hearing all these types of losses and ways people lost. One thing, their person who died. One thing I was like, my partner is not having a motorcycle, because I would hear these horrific accidents of their person who died dying in a motorcycle accident, and just really that overprotectiveness of the people you care about. And feeling lonely because you may feel like I alone am the only person who understands what this feels like, or I need to carry this alone to get through this. I need to be strong. Some physical reactions can be just having rapid heartbeat when you start hearing the story, or reminded of that, of the support that you provide to your clients or your families. Having physical pain such as joint and muscle pain, feeling dizzy or disorientated, or just system you're impaired to your system. One thing that happened to me that I felt was actually physically getting ill, just getting sick really easily because I was not taking care of my body, and my body felt really exhausted as well. Wanda, I believe you're. There you go.
Yeah, thank you. So hearing what you're saying and going through that list of symptoms, we thought it might be helpful just to listen to somebody who is an expert on this and kind of the experience from her perspective. Always nice to hear from others as well. And this talk by Amy Cunningham is about 12 minutes long, not real long, but it's titled Drowning in Empathy, the Cost of Vicarious Trauma. So we'll just invite thoughts, feedback at the end of listening to Amy.
You may need to reshare your screen and make sure that you've enabled the computer audio to get the video audio to work.
Thank you for letting me know. Let's see. These are one of those technical difficulties we talked about. Okay, let's try this again. Let's see.
Are you ready? Cow. Okay, so most of you maybe were thinking this. Maybe a few of you were thinking more this. And maybe some of you thought this. We'll do another one. Work. Awesome. So some of you really love your work, like this. Maybe a few of you were thinking this. And I wonder if anyone felt this. We'll do just one more. PTSD, or post-traumatic stress disorder. So most of you thought this. Maybe a few of you were thinking this. But I wonder if anyone thought this. Compassion fatigue is the post-traumatic stress disorder related symptoms that you receive vicariously as a secondary target to trauma. Compassion fatigue is experienced by those in a helping profession. Doctors, nurses, counselors, therapists, police officers, and maybe even you. If your unpaid role is that of a helping professional, then you may also be affected by compassion fatigue. If you are the middle of the night phone answerer, or helping a friend through addiction or anxiety, if you are raising children or caring for parents, or maybe both at the same time, if your unpaid role is that of a helping profession, compassion fatigue could be affecting you as well. Now, what puts you at a greater risk for compassion fatigue is empathy. Those generally in a helping profession have a very strong empathetic response system. And empathy is that ability to pick yourself up and put yourself in someone else's shoes and get it. Really get where they're coming from. The problem with empathy is you don't get to decide when to jump out. And those traumas that they experience begin to change you. I remember when I was the supervisor of a therapeutic group home, and I was sitting down with one of my clients. She began to tell me the horrific and painful stories of her past. And as she laid out in detail what she had experienced, my cell phone began to vibrate. And I wanted to show her that I was listening and I cared about every word she said, so I picked it up and I silenced it and I put it back down and I continued to listen. From that day forward, every single time I picked up my cell phone, swiped to silence it, I was transported back to her trauma. My brain had created a PTSD-related symptom that transported me back to her situation every single time for years. Now, this would be pretty normal if it happened that day after work at the grocery store, or maybe even a week or 2 weeks later. But where we get concerned that maybe this trauma is starting to change you is when it's sticking around for 4 weeks, 6 weeks, and maybe even longer. Now, for many years, compassion fatigue was confused. People called everything burnout until Dr. Charles Figley came around in the late 80s and 90s and began to do research. We called it burnout. But the truth is there's a significant difference between burnout and compassion fatigue. Burnout has to do with being worn out and tired and just flat out not liking your job anymore. Compassion fatigue has to do with being afraid. Compassion fatigue begins to change your hardwiring, change who you are. We see this a lot in child protective service workers. They start to become overly vigilant, believing that everyone is out to hurt them and their family. When I think of this, I can't help but think of the nurse who came after one of my classes and said, still to this day, she can see the broken bones of the young man who was abused by his parents. That still today, she knows the smell of death from a patient who laid in bed dying. These memories, they do not just go away, and they begin to change you. But we like to make excuses because we think we're superhuman. So we say things like, I'm fine. I'm a professional. I can deal with the stress. In fact, it doesn't even stress me out. My famous talk off was, I've been doing this for 15 years. I know most people think it's stressful, but I'm okay. The problem with that is when stress and trauma start to affect you, your brain and your body, they do not pull for your opinion. And they will start to show signs and symptoms because your body and your brain are shouting at you, I am not okay. I cannot handle the trauma. In little ways, whether you start to have sleep problems, either you're sleeping all the time or not able to sleep at all. Another way it manifests is becoming a workaholic. Now, I know plenty of you in this room think, Amy, there's nothing wrong with being a workaholic. Get off my toes. Let me tell you why it may be a problem. Because when we start to feel like we are losing control of the world around us, what we do is we roll up our sleeves and we work a little harder. And I can work hard enough to make this trauma go away. Another sign and symptom is feeling unappreciated and under-resourced, like what you have is not enough to get the job done. Now, I'm not saying that's not true. There's a very good chance you are indeed underappreciated. But when you started in this helping profession, or when you started helping your friend or your family member, did you know you were going to be underappreciated, but you said, it's okay. I want to do this anyway. It's okay. I love you enough. But then somewhere along the way, that is no longer okay with me. It is no longer okay that I am not thanked and that I don't have what I need to succeed. What that tells me is your circumstances, they didn't change. You did. Maybe you changed because of life. Maybe you changed because of maturity. But maybe you changed because of compassion fatigue. And the last symptom I want to talk with you about today is called self-entitlement. And self-entitlement is a justification of negative maladaptive behaviors because of the positive things you do. The best way I can picture putting this is most of us went to school and got a degree or a certification to be professionals at what we do. But the truth is, I'll let you in on a secret, that's not enough because we're overachievers. So we require little invisible badges to really be professionals. Let me tell you what these invisible badges look like. For social workers, I know it looks like this. I stayed up all night long helping Joe Smith at the hospital. Now I'm a real social worker. For some healthcare professionals, I know it looks like this. I worked 2 shifts in a row. Now I'm a real healthcare professional. Where this turns into self-entitlement is when it looks like this. I stayed up all night helping Joe Smith at the hospital. That's why I'm a little cranky today and biting everyone's heads off. I worked 2 shifts in a row. In fact, I worked 60 hours this week, so I'm getting wasted all weekend. We begin to justify the negative behaviors because of the positive things that we do. Now that I have thoroughly depressed you, I want to give you some good news. That compassion fatigue can be identified, arrested, and treated at any time. That you can begin this journey for post-traumatic growth. That you can be better after trauma than you ever were before. And the best way I can think of putting this is when you think of an airplane, you know that the stewardess tells you where those exits are, and then they begin to tell you to please put your mask on you first before assisting other people. Now, every time I travel for vacation with my family, I show the stewardess that I'm listening. I get the cue card out of the backseat pocket and I give eye contact. I'm almost the only person on the plane listening. And I show if the plane went down, I could save the plane. I'm real intense about it. And yet it never fails. Every time they finish, they come over to me and they say, "Excuse me, if there were a change in cabin pressure, what would you do?" And I'm a little offended. I don't know why they asked me that. But you see, that flight attendant, they see something you don't. They see the carry-ons that I travel with. They see this. They do see me. And they see this. You see, that flight attendant knows that no matter how much I listen to her, that I will put their masks on them first before caring for myself. But you see, she also knows that no matter how much of a supermom I believe I am, that I cannot live without oxygen. And yet every single day we do the same thing. I put your mask on you, and your mask on you, and your mask on you. And I don't care for myself. But you see, we can only give what we have. We give out of who we are. And if I don't care for myself, I certainly cannot care for you. So I'm going to ask you to complete a piece of homework for me. And I'm going to ask that you please do this every single day for the rest of your life. I have big expectations. I'm going to ask that you take 10 minutes just for you. 10 minutes to put your mask on you first. 10 minutes to pray or meditate, to exercise or take a walk, but 10 minutes to care for you first. Take 10.
While Isabel is closing out that screen, I just want to invite anybody who has a thought or a comment, something that maybe was sparked by listening to what Amy was sharing. You can feel free again just to speak up or put it in the chat either way.
This is Sue, and this is probably where I would plug part of self-care could be going to a support group, either for yourself or for the loved one that you're caring for, which we offer here, of course, at Catholic Healthplex. But that's my plug. I think when you know other people going through the same thing you're going through, it makes your burden or journey easier. And support groups are good for that.
Could not agree more, Sue. Thank you. And we know that you offer a nice variety there. So we're hoping to be able to get and back in our support groups in person as well. Anything for you, Isabel, that stood out in what she was saying?
I think what really stands out all the time with me is when she referenced her kids, because personally, I feel like I think about compassion fatigue in a professional setting, and I forget about how compassion fatigue can really affect my personal life, and how even in our personal lives, we often are the caregivers, the person people go to, maybe the mediators, or that person, that support system in a really difficult situation. And we forget, or at least I did, I forget that I also need to take care of myself in order to give more of myself to this person, to the situation, to the supporting environment. So that's one thing that always really stands out to me of I want to be the super person, the super amazing support, whether that's to my family, to my friends, or to my colleagues, or families that we work with here. But what is it that I need to do to take care of myself in order to do that?
Thank you. I saw that there was a comment in chat, but we couldn't see the whole thing. Megan, is that something you could read for us?
From earlier in the program, Lori had said, good point, thank you, when she was, after she had mentioned that her work with the Cancer Center and talking about, what to say to somebody or what not to say. But we haven't had any comments related to the video.
I see one from Emily that shows, I love the message, self-entitlement is a gradual acceptance of our negative responses to our positive behaviors. It's great insight to help recognize, combat compassion fatigue. So thank you, Emily.
And that was something, Emily, that was new learning to me. The very first time that I watched this, I would not have put the connection between compassion fatigue and just a sense of self-entitlement for kind of not the best behavior. So it was good. Thank you. We're gonna go ahead and move forward to a tool, a scale actually, that may be helpful. Some of you may use this, have used it, some may just be familiar but never have completed it. It's called the ProQual as an abbreviation, which stands for the Professional Quality of Life Scale. And this scale is a set number of questions. You answer the questions. Well, we're going to show you the scale here in just a minute and invite you to if you've never done it, to go locate it on the internet and periodically do it, just to kind of measure where you are. It kind of helps you to recognize if you have compassion fatigue by becoming aware of maybe what some of your warning signs are. And Isabel's going to share a little bit about her experience in this area.
Yeah, thank you, Wanda. So Wanda might have mentioned or not, we actually use this protocol and have used it many times within our team, within our agency, as a good check-in of where we're at as staff members. What is it that we need to support one another? And we've used this, and we actually did this a few years ago when I was interning at Quark's Place. I was in grad school and I had a lot on my plate. Supporting family, homework, the, study expectation of just being in grad school, and, interning, and what that entails and the type of work that we provide. And I remember taking this test and thinking that it was wrong. I did it and I was like, wow, this can't be right. This says I'm really burnt out, or, I have a lot of stressful factors. But in my mind, I was like, well, that makes sense because I'm studying, I'm in school, I have all these different expectations, but I'm fine, I'm okay. And around that same time, I reconnected with a friend from high school. She was getting married, just catching up, telling me about her life. And she said, oh, we should hang out, we should, get back together again, touch base. What do you do for fun? What is it, something that you can do that we can do together? And I sat there and I couldn't give her a response because I wasn't doing anything at that time for myself. I was, being in a parental role, I was doing school, I was doing work, and just so exhausted at the end of the day that I wouldn't really do anything for myself. So that was a really huge wake up call for me of what is it that I'm doing for myself? What are some fun things that I actually enjoy that help refill me, rejuvenate me, bring me joy into my life that I can start incorporating?
Thank you, Isabel. Let's just forward this to look at the pro-qual. We won't spend a lot of time on it, again, because our hope is you'll look at this when you have a little more time to really answer the questions. But as you can see, they're pretty basic. These questions do have the word, as you can see in their help. You can put whatever word fits your particular situation. Or wherever you work, or at home, or if you teach, or again, whatever word works for you. So once you go through and then you answer the never all the way through the spectrum to often, what you're actually measuring there, the way it's constructed is that you're going to be measuring what's your compassion satisfaction. What part of what you're rating brings you joy or happiness that you appreciate? What's your burnout scale? Where is that? And then secondary traumatic stress. So by answering those 30 questions, you're literally learning how to break down or define, if you will, where you are in your compassion satisfaction, your burnout scale, and then your secondary traumatic stress scale. Is there anybody that has done this or used this scale in the past that would like to share any comments about it? Or if you've done it at a particular point in time and then redid it at another point and had a vastly different number? Anything anybody would like to share? Feel free to add your comment in the chat if you have one. We are going to go ahead and move to the second video that we're going to be showing today, which I think is as good. It just covers different material. Self-care, what it really is Self-Care Made Simple by Susanna Joy Winters. This one is about 10 minutes long, and we hope that you enjoy it, and we're open for you to share after we watch it.
When was the last time you were stressed out? I take that as on your way here. Maybe you were on your way to work, running late, and stuck in traffic. Or were you at home paying your monthly bills? Maybe you were just watching the 5 o'clock news. Your heart starts racing, your palms get sweaty, your stomach jumps into your throat. We experience these body sensations so often, we don't even know the difference now. So indulge me for a minute. If you have anything in your hands, just set it aside. Plant your feet firmly on the ground. Close your eyes. Inhale with me, in through the nose. Exhale through the mouth. Inhale through the nose. Exhale through the mouth. When you're ready, open your eyes. Congratulations, you just practiced self-care. It can be that simple. Unfortunately, the $10 billion self-care industry doesn't want you to think so. There's this myth that's fed by Instagram posts and countless advertisements that self-care is a spa day, pedicures and Prosecco, a weekend-long Netflix binge, anything pumpkin spice related. All these indulgences are great, but they're not self-care. We're left chasing these perfect self-care experiences, and they don't actually restore us. So we're left with a question: if that's not self-care, what is self-care, and how do I practice it? Self-care is deliberately taking care of your well-being through restorative activities. One of the greatest threats for our well-being is physical and emotional stress. Stress is one of the leading causes of healthcare issues in America. And we experience it every day. We experience stress by what we put in our bodies, what we put on our bodies, the thoughts that we think, and the choices that we make throughout our day. Some of the most stressful things that we can put in our bodies are sugar, alcohol, excessive caffeine, and processed foods. Those are also some of the most consumed items in America. So with all this stress impacting our immune system, our energy levels, our emotional well-being, it's essential that our self-care practice does the opposite. About a year ago, a coworker asked me what I did for self-care. I cringed when she asked me that question. I said, I eat and I sleep and that's enough, totally brushing her off. At the time, I was managing a high-volume retail business in Washington, D.C. My husband and I were starting a company, and we're raising our 2-year-old son. I started every day with coffee and a scone, went to work, had very few breaks, and finished my day watching Netflix and scrolling on my phone. I was in complete denial about what I needed to do to take care of myself. Ultimately, I burned out, and I quit my job. I decided to pursue a passion of mine, and I began working as a labor doula and a childbirth educator. Now, a large aspect of that job is to support pregnant women and prepare pregnant women to be as relaxed as possible during what could be a stressful event in a stressful environment. And I learned really quickly that to be successful at that, I had to be a relaxing presence, which meant I had to take care of myself. And that's when I discovered how to practice self-care. My foundation began as a diet rich in fruits, vegetables, and whole plant-based foods. And then I added in 3 restorative activities to make my self-care practice. The first, moments of stillness and in silence. We just practiced this a few minutes ago. We are bombarded by noise every day. The TV, the radio, traffic, our kids yelling at us. But the loudest noise of all is the voice in our heads. We have roughly 60,000 thoughts a day, and for some of us, 80% of those thoughts are negative. When we meditate and have moments of stillness and silence, it brings awareness to that internal voice. And when we have that awareness, that's when we can choose what thoughts we're holding on to and which we want to let go of. We can also adjust the volume on how loud that internal voice is. The first time I meditated, I was sitting in a chair and I immediately got squirmy and my back started hurting and my internal voice got so loud and it was talking about all the things I should be getting done on my to-do list versus sitting doing nothing. But I committed to 5 minutes a day, and slowly but surely that voice got quieter. I have one suggestion for starting a powerful meditation or stillness practice, and it's simply to be comfortable. You don't need to sit in a straight back, rigid chair. You can actually be comfortable on your couch. I actually encourage you to be as comfortable as possible without falling asleep. The second restorative activity I added in was movement. This could be walking, running, dancing, yoga, jumping jacks on your living room floor. Our bodies are meant to move. And when we move and when we exercise, it creates endorphins, which first, they help sleep, which naturally reduces our stress. And it also sends a positive feeling through the body that's similar to that of morphine. You don't need a fancy gym or trainer to do this, although they may help sometimes. And just 10 minutes a day makes a difference. The last restorative activity I added in was time in nature. According to environmental psychology, time in nature will improve your mood, reduce stress, and improve cognitive function. And the Environmental Protection Agency says that the average person spends 93% of their life indoors. So we're left with this incredible opportunity to support our well-being simply by going outside. We are animals of nature, and we often live completely disconnected from our natural environment. We may go days, if not weeks, without our bare hands or feet touching the ground. My son, he's almost 3 years old. He's the most kinesthetic child out there. He loves being outside. If I let him, he'd spend all day outside, in the backyard, at the beach. And when he's outside, he's not just being outside. He is rubbing his hands into the dirt. He is touching leaves, trees, and catching frogs. And I could never understand why his shoes didn't stay on his feet for more than 5 minutes. But maybe he was onto something. The term earthing is now being used to describe your bare hands or feet on the ground, our earth. And there's a renowned cardiologist who says that the reduction of inflammation due to earthing can actually be documented by infrared imaging and white blood cell count. Some of the other benefits include reduced stress, improved sleep, improved circulation. So it's no surprise to me that when my son spends most of the day outside, he naps, he sleeps like a rock, he eats everything I give him, and there's very few emotional outbursts. When you combine these activities and practice them daily, it will support your mood, increase your energy, increase your joy. Imagine if you practice self-care for 30 minutes a day, 10 minutes of stillness, 10 minutes of movement, 10 minutes of time in nature, on top of a diet that is rich in whole plant-based foods. That's over 180 hours of self-care in a year. But I'm so busy. When am I going to get time for 30 minutes a day of self-care? Well, we can start by looking at the 5 hours a day that the average person watches TV, or the 50 minutes a day that we spend on social media. We can start there. But before you get worried about adding a self-care practice onto your never-ending to-do list, remember that it is a practice. It's not about getting it right or having the perfect self-care photos for your social media. It's about showing up for yourself every day. What would be possible for you if you showed up for yourself? Thank you.
Thank you, Isabel. Wondering if anybody had any thoughts you would like to share, or if this triggered a particular story for you around what self-care can look like. The first lady, Amy, talked about just taking 10. This lady, Susanna, broke down a half hour a day into 10-minute, 10-minute activities. Does anybody already do some kind of a practice for self-care that you want to talk about a little bit?
We have a quiet group today.
That's okay. No worries. We'll just keep moving forward. So this next part, Isabel is going to talk, or not talk, but just explain or offer some self-care strategy questions.
Thanks, Wanda. And these are more questions to pose to yourself of what self-care looks like to you and what is manageable. I think that's really important too when it comes to creating a self-care strategy or plan for you is what is it that I'm able to do? Just because in the last video, she mentioned that it can feel very overwhelming and it doesn't have to be, this perfect plan, this one size fits all. But these are some helpful questions to start contemplating or asking yourself to help build that strategy, build that plan. The first question is, who is it that you can talk to that you trust? Who are some of those trusted support systems, whether that's a family, friend, clergy person, or a healthcare professional? And not only who are those people, but also when is it that I need to move on from one person to another? Because sometimes that person may be a family member, but you're so overwhelmed at work, or you experienced this traumatic event, or you're to a point where you feel like, okay, I need to transition from talking to this trusted family member to moving also with a healthcare professional, a mental health professional. So knowing what that looks like for you. Where can I learn more about compassion fatigue and its effects? Whether that's taking classes or training similar to this, or doing your own research. Maybe it is starting a conversation within your agency or a conversation with trusted family and friends. What are their self-care strategies or their thoughts on compassion fatigue? What kind of exercise am I willing to commit to doing on a regular basis? And it's commit to doing on a regular basis that gets me every time. Because I feel like we can easily say, oh, my goal is to, go to the gym 5 times a week. But is that manageable? Is that realistic for you at this point or this time in your life? Maybe it is just, taking a 10-minute, 15-minute walk a few times a week. And that's okay. Just what does that look like to you? What movement or exercise are you able to manage or physically do at this time? And how do I start integrating a whole plant-based diet in my life? For me, I'm sorry, I can't give up really good snacks, but maybe I can start incorporating more healthier options and maybe, slowly weaning off of not drinking coffee every day or not eating as much sugar, or when I'm stressed out, not reaching for those unhealthy options, but more of a healthy option for me. Continuing those questions, what do I need to change to get a more restful night's sleep? That may be, setting our phone aside. I know sometimes we like to, maybe I personally, I would used to be on my phone all night just on social media, but is that really helpful for me to get a restful night's sleep? What hobby can I start or resume that brings me pleasure? That brings you joy? Is that something that was there an activity, again, a hobby that you've done in the past that you really enjoyed, and for whatever reason you set aside because you needed to focus on responsibilities or this never-ending checklist? Or what is something that you always wanted to try that maybe you can start slowly incorporating into your life? What is one strategy that I will implement to cope better with stress? And again, it might be helpful to speak to those around you. What is something that they have done, whether that's in your professional life or personal life? What are some things that others around you have done to help in their stress in their life? And the last question, what type of support group or network would benefit me the most right now? And that can include all different types of support groups, whether that's a grief support group or different support groups that also Cadillac provides, or some type of support group outside of maybe a professional agency. And this is just an example of my own personal self-care plan. And it doesn't need to be complicated. I literally wrote this in 5 minutes. And what I like about this is that it covers all the different aspects of us as a human being. Because sometimes I feel like we forget about the different layers we have as a person. And I can tell you right away, one thing that I put down was daily walks. And I quickly realized that is not something that I was able to do. But again, that's the beauty of having your own self-care plan. It's discovering, trying something and discovering, is this manageable for me? Is this something I can do and commit with? And giving yourself grace, letting it be okay that maybe that's not something I can do every single day all the time, but I would like that to be my goal. And how can I make this work when possible?
So looking at our determining what our level of compassion fatigue is, or that secondary traumatic stress or burnout, and trying to figure out how much we need to maybe make a change to our daily routine or weekly routine, and then seeing how Isabel used kind of that same model of all the dimensions of our being, the physical, emotional, behavioral, and then she plugged in some things she thought might work for her, having to make adjustments, but really not to make it simple, because it probably isn't simple. But in the process of making some kind of a change, I find this helpful, thinking of the 3 A's of change, all broken down into everything starting with an A, like the first one, awareness. Where is it that I'm at? What is it that doesn't seem to be working well for me? What is it that I'm doing that is working and I need to do more of, or more often, or for a longer period of time? The second one, accepting. Accepting basically meaning in this context, it's my responsibility to make these changes. I can't expect somebody else to do that for me or to change their life. I mean, maybe there's some things in relationship we need to ask somebody to do that they are responsible for doing, but they're not responsible for my self-care or the choices that I make that either help me to heal or help me not to stay so healthy. And then the third one is action. What steps do I need to take to begin to move forward, or to implement a plan, or change the plan, do something different? And I realized that I can be stuck at any level in the 3 A's of change. So I can just not even be aware, not think about it, and not do anything to try to figure out why I'm feeling so tired all the time, or why I'm irritable was one of those symptoms when we were looking at the symptoms of compassion fatigue. Or I can really try to sit back, do some kind of self-inventory to help determine what's going on, what am I feeling, where's it coming from? Oh, I'm just exhausted and it's just a temporary thing, maybe from something just circumstantial. Is it more pervasive, long-term? And accepting that whatever it is, whether it's some short-term or long-term type thing, accepting that I'm the one responsible for making a change to shift how I'm feeling or what's going on for me. And then third, just like Isabel talked about, what kind of action am I going to do? What plan am I going to come up with? Maybe it's starting with one item, because I just can't think bigger than like a whole worksheet like she had filled out. Maybe I'm just going to make one small change, give it some time, measure it, and then go from there. So just to offer that, the 3 A's of change is a way to kind of think through where you are, where do you want to be, and what's the process that can help you move forward. This next slide is, again, we would have under some of the other types of meetings we've had done breakout sessions where we would broken into smaller groups. Again, Teams isn't accommodate that for us. So we'll just put this out there for open discussion for anybody who might want to contribute to it. Professional self-care. How does your professional community view compassion fatigue? Is one of the questions. The other is, what formal or informal support systems are in place currently to recognize or respond to compassion fatigue? And if there isn't or something's not available, what would you like to see happen? How would you like your workplace to do something different to recognize the importance of this? And again, anybody can add a comment in chat or can just unmute and share a comment either way.
And Wanda, I'd quickly like to add that this also can be expanded to our personal life of how does our own family culture view compassion fatigue?
Yes. While you're thinking about that, I just, as I was reading these, I was thinking about, for us as an example, years ago in chaplaincy healthcare, we had support system in place where we offered support sessions to a variety of staff when I was in the hospice program. They were regularly scheduled. They were called support group for different staff. You could attend, talk, not talk, listen, just take the hour to breathe, share with each other. And they were often very effective. And just as life happens and workplaces get busier, more going on, people realized how much more they needed it and how much less time they actually had to be able to attend one. So I know it's become much more informal, I would say, in our agency. Now, the program I'm in now, Corks Place, we do it much more on an informal basis or an as needed basis because we're very aware of compassion fatigue and grief and loss and the toll that those can take on our ability to really perform well or do our job effectively. So I would say right now, and then especially with COVID and all of the other requirements, I think we're just right now kind of doing it on a much more informal basis as needed. But how about you, anybody, whether it's personal, like Isabel said, or in your workplace? What thoughts would you like to share? We're going to go ahead to the next slide, which is an acronym that can maybe be helpful. You might already be familiar with it, and starts by saying, are you feeling overwhelmed? Remember the acronym RAIN, R-A-I-N. And it's 4 steps to stop being so hard on ourselves. R being recognize what it is that's going on. And again, going back to Isabel's kind of the breakdown, the dimensional breakdown of the symptoms of compassion fatigue, those were using that same breakdown as well as the self-care breakdown. What is it? Is it more my spiritual self that's struggling? Is it my body, my physical self that's having the most? Am I noticing more aches and pains? Is it relational, my personal relationships with my family or friends or at work? Is it behavioral? Am I doing things that I wouldn't normally do that are kind of out of character that maybe I need to take a look at? Where are those coming from? How are they serving me well or not? And then A, allow the experience to just be there, just as it is. I think maybe this is not true for you, and Isabel, you can sure add to this. I think this is a particularly tough one, as I've learned through the process of supporting grieving people, and that is that allowing people to be in their space of grief, anxiety, pain, yearning, loneliness, guilt, those more related to grief, but some of these things we're noticing with compassion fatigue, can we just recognize what they are, allow them to be there, so we get some sense of how it's really feeling and really impacting us. And then thinking about what I stands for, investigating those with kindness. I think, Isabel, you mentioned earlier, not judging as we do some of this self-evaluation, self-assessment, self-inventory, being kind. Everybody, I think it was Emily, I'm sorry if I have the wrong name with the wrong story, but sharing about how, but well, I know several stories, one about the being in the medical profession, as well as working in the library. In both places, just the expectations are going up, the fears have gone up for all of us because of COVID. And kindness is something that's a little bit harder, it seems, to come by. We all want to, and we all have a lot of different feelings going on, but can we sit in it, allow it, look at it, feel it, sense it, and then think about kindly, what is it we need to do with that? So that N, the N, stands for natural awareness, which comes not from, I don't identify with the experience. I am not my irritability. I'm experiencing irritability, but it isn't define who I am as a person. I don't have to live in this state continually. I can acknowledge it, see it, acknowledge it, and then gently, kindly figure out what I'm going to do with it. So not becoming these folks who compassion fatigue has just taken over, and we have no sense of how we're going to get out of that space or that place we find ourselves. Isabel, you have any thoughts about that?
Yeah, just going back to allowing the experience to just be there, just kind of sit in that. One thing that can be difficult or maybe comes to mind is, feeling like I don't have time for this. I don't just have the time or space to really sit with that, just to allow that experience to be there. So maybe putting parameters or actually scheduling in time to process, to sit in whatever feeling that you're having in that moment can be very helpful. One thing that we do here at Quark's Place is we actually have a post meeting after group. Because sometimes we'll hear really hard stories during group, or things can be very triggering in ourselves as facilitators, as support people, to the kids, to the children and youth, that we need to give ourselves time to process through, to allow to be there, and then continue and investigate with kindness, and continue on with the RAIN acronym. But actually scheduling yourself time might be a helpful option to start implementing that into your life.
Thank you. This slide, I liked the saying and we offer it to you. You can offer your feedback or thoughts about it. It says, do not sacrifice yourself to help others. Increase yourself to help others. Your service and caregiving is a gift that should be nurtured and preserved. Be intentional and diligent about your own self-care. I think Amy kind of talked a little bit in her video about sacrificing, how we tend to want to do that as a way of serving people and caring about them, but often we do it at a cost and an expense, which is either our self or our sense of groundedness or healthiness or whatever. We want to give more than we replenish that we have given out. So it's just asking that it's kind of a both and for the best circumstance or the best outcome. Do give, do care, do offer support or help in the workplace, at home, in our personal lives, and at the same time fill back up on a regular basis, and being intentional about how we do that or what that's going to look like. Just before we get to the end slide, we want to let you know that we have resources. We have some of the resources we included in here. We have a list at the end of the PowerPoint where we have books that can be very helpful to learn, for example, how to communicate better. We have a list of websites that people can look up, get more information about some of the things that we've talked about. So another resource that I had included on here were some DVDs about eating healthy. I think maybe some of you might be aware of the DVD Forks Over Knives that I found very interesting years ago, and I had watched that about how to kind of switch to more of a plant-based diet or incorporate a little bit more. There's a CD set that I included on there from Dr. Andrew Weil about breathing and how breathing can be incredibly helpful, or learning how to breathe in a more appropriate way can be incredibly helpful to just well-being in every kind of a way. So it's a 2 CD set, and the first one he's talking about how the body works, how it functions, and how breathing can really change the state that we're in. Maybe I've had people talk about being in a place of experiencing a lot of anxiety or panic attacks. And he addresses this in his CD, how he has helped people to learn how to manage that just by learning some breathing techniques and practicing those over and over. I see they have the list of books up. There's emotion coaching, which we had the handout of. They have a whole parent handbook and DVD that I haven't read it word for word, but I do have it and have looked through it and thought it had very good information. If it's looking for what to say to kids around loss, around grief, death, and just the communication, what to say, Dr. Alan Wolfelt has written over 40 books. The second one there on the list, Finding the Words, How to Talk with Children and Teens About Death, Suicide, Funerals, Homicide, Cremation, and Other End-of-Life Matters. And one thing I appreciate about this particular book, a lot of his books are very good, but this one literally gives little snippets of conversation about what a question might be we're asked, what we typically might say, which isn't as helpful, and then what could we say that would be much more effective. And he does that in throughout the little booklet. It's not a very big read. Another couple of books here, How to Talk So Kids Will Listen, and Listen So Kids Will Talk. Kind of not a companion, but for a different age. How to Talk So Little Kids Will Listen, a survival guide to life with children ages 2 to 7. And then they also wrote one for teenagers, How to Talk So Teens Will Listen, and Listen So Teens Will Talk. So they kind of cover the childhood spectrum. Those have been very popular, very well received when I've talked about them in the adult support group. Adults, parents, grandparents, aunties, different people who are raising children that are bringing their children to grief group have bought those, either the audiobook, downloaded it, or bought the book and read it, and say how really helpful it's been. Just in opening up communication. Preparing the Children, Information and Ideas for Families Facing Serious Illness and Death, written by a nurse with a lot of years of experience in hospice care. Very simple read, easy read, bullet points, but gives people some practical ideas, suggestions, and thoughts on how to support children before, during, and after death. A little bit heavier read, some of you may be familiar with, is The Body Keeps the Score, Brain, Mind, and Body in the Healing of Trauma, Very interesting book. Bessel van der Kolk does a lot of trainings on this topic of trauma. His organization did a lot of work, a lot of research prior to his writing of this. Another book on here we have is the Compassion Fatigue Workbook, Creative Tools for Transforming Compassion Fatigue and Vicarious Traumatization. And then the last one, which again can be more related to communicating, but also just understanding children, where they're coming from to know how to communicate more effectively, is The Whole Brain Child. So these are just some of the resources, kind of a mixture that we've added to the end of the PowerPoint slide here. Some of those DVDs, emotion coaching. We use the Helping Children Grieve DVD that can be ordered. It's about an hour long. We've taught classes based on that. A 7-part DVD has just very practical, concrete information, as well as lots of interviews with people living in a real place of loss and how they're coping. Supporting the grieving child, helping teens cope with grief, and then the last one, understanding suicide, supporting children. All resources from the Dougie Center, who were modeled after. They have other DVDs. They have lots of resources in Spanish as well. Some of the written books and DVDs are in Spanish. And so we would just suggest dougie.org is their website to go look. Children Grieve, compassionfatigue.org, another Dougie. We talked about Forks Over Knives, Good Grief. New York Life has some really good information on it. Parenting Counts, where they had the handouts. Pro Call, we talked about that measure or that scale. Sesame Street. The I don't think I have it on here, but there is another website for teachers. It just has good information for anybody, but it's grievingstudents.org. And that has a lot of good handouts, video, little vignettes. It actually has 3 PowerPoints on their slide, or I mean on their website, I'm sorry, but all resources to help school personnel know how to support children in a place of grief and loss. So anything, Isabel? I know we kind of went quickly through the resources, but others that you're thinking of or something that I might have overlooked?
I can't think of anything specifically, but sometimes there are specific requests that people may be looking for. So I put up our information, so please feel free to contact us directly if you're looking for a specific type of resource, or just maybe want to have a conversation about how you're able to support a grieving family or a grieving person in your life. And we can help, have that conversation and provide additional resources as well.
I'm going to pop in too. This is Sue. Sorry, Lori, I guess I interrupted you if you wanted to talk first. Oh, Lori is typing. I posted our library link in the chat because a number of the resources you mentioned, like Forks Over Knives, and the Andrew Weil, we have a large section on breathing techniques and mindfulness. We might have those in the library. You can just check them out. It's free. And you can check to see if it's on our shelf by searching the library catalog. Emily had also posted the ProCall website also in the chat. And Lori was typing, but it didn't show up here in my, I don't see it in the chat, but I saw her typing. Oh, there, she says thank you. And then, sorry to interrupt. That was my 2 cents worth.
Well, I appreciate that a lot, Sue, because actually that was where I first checked out Andrew Weil's CDs on breathing, and at that time from your library, Neurological Resource Library had checked out multiple CDs on that. They were very, very good, and liked that one by Andrew Weil so much I went and bought it. So thank you for carrying those.
Yes, and if you haven't noticed, we also just started carrying James Nestor's book called Breath. It's on the national or New York Times bestseller list right now. It's an excellent book on breathing and how it's evolved over time, and why it's important that we retrain ourselves how to breathe properly. It'll help with stress and a multitude of other things, sleep. So that's also in the library.
Thank you for that. Can keep us out of the doctor's office a little bit more, maybe.
That's right.
So as we're coming to a close, we just have a couple minutes left. Does anybody have anything in particular you'd like to ask or share, or anything that's been more, like, was session 1 more helpful if you attended both, or session 2? Anything you'd like to say or ask would be fine.